you so much for your concentration. I'm just going to wrap up a bit about this information about React, and also to tell you what we're doing and how we're trying to make sure that React does get adopted, does get widely available. Okay, so we looked at the use or the way that we could support the offering of React through early intervention services across 6 NHS trusts. And they're given different names here so that staff within them felt comfortable to share their experiences, but they weren't going to be identified by trust. And as you can see on here, we have the number of accounts created and the number of relatives accounts created. So what happened was relatives were invited by early intervention staff to create an account, and then they could access the whole of React. And what I want to draw your attention to is the differences here along this bottom line numbers. There'll be loads of reasons for this variation, but what we wanted to do explore was, what about the implementation process? What worked well in some services and didn't work in others? And then, what was it, pinch with pride? Someone said, then we pinch with pride what worked in different teams and then shared them across the others. So the factors that helped offering React, and I know there are many people here who work in services themselves, was identifying people within a service who were already working with carers who were digitally confident. As we said, one of the barriers, as Sonia said, was that if you ask someone to do something new, something different, then asking people to shift too far is a challenge for people. So one of the ideas we Pinch with Pride was that people wanted to champion the use of React within their teams, to be the person that others came to when they had questions about it or difficulty logging in themselves or things like that. So there's a sense of ownership and mastery within the teams. And the other important thing here is that it should be offered as part of the face-to-face contact. There was definite resistance or concerns around this being something that was trying to replace them, like asking turkeys to vote for Christmas. It's never going to work as far as asking someone to do something new. So making sure that it was integrated with the support that was already being offered to friends and family. Factors that didn't help, as Sue and Steve has said, this interacting with people online and managing the risk and what that actually means for their personal practice was a big concern for people. And what would happen if risk events were identified. Also didn't help when teams were trained and then there was big staff turnover within teams. So that, along with competing priorities, I'm sure you'll know there's different things being audited at different times. So research is one thing that was not necessarily seen as a priority, but there were other targets that teams were being audited on at the time. So the last one on this is the research is the kiss of death. Okay, we know as researchers that when we come into a service, your priority is not research. Neither should it be necessarily. So having something badged as research meant that it was seen as something that was going to go away after a little bit. So why are we going to invest in it? So the take home for this is definitely, if you're thinking about developing anything and you're working with a team or service or group, is to do it with the services and have it as part of service development and evaluation, rather than badged as research if possible. What worked really well was having these active cycles where instead of going, why aren't you offering it more to staff or things like that, we asked what was going on for people, what worked well, and we problem solved together with carers, with staff, with the digital team up there, to make changes to make it more useful and sustainable over time, as much as we could within the study itself. The resounding message we got from carers, and part of what we found worked really well for staff, was knowing that carers had appreciated it, did find it useful, had got on, was that carers wanted to be offered this kind of information and support as soon as possible. Don't wait for the right time. I don't know what the right time is. Just make it available for me, and then I can choose as a carer when I access the information. Again, this not replacing face-to-face support, and the ideas of it not being just another leaflet that was handed out. Someone said that their house was a chaos of leaflets of good ideas and intentions, but actually having it all in one place and having some videos so they could see real people talking about their experiences really helped. Factors that didn't help was technical problems accessing the site. I would say don't have a similar named research study as the one that you're running, because it can be really difficult. So thinking about how it's named and making sure people can find the site really quickly. Seems obvious, but these are the things. The lack of activity on the forum meant that people were unsure about starting or getting on the dance floor first, really. So if from this we realise that it's better to have maybe a central model where there's more people, because not everyone will want to actually post on the forum to get things going. They will, some people will just enjoy reading the forum and get a lot of benefit out of that. So drawing from a wider pool will make forums work. And then the last one is that people wanted more information about different things. So if they didn't find the information they wanted, then we suggest having a mechanism that you can create that material with people so that you can expand the range of information that's available to respond to the changes. Websites never finish, and part of the joy of them is that they can be updated. So what are we doing now? We are exploring a way to make React available and sustainable beyond the research phase. And we have redesigned the React website, updated the content based on feedback from people who used it and staff, and made it easier to access and use. So it's going to be available for another year from this point forwards, and over the lunch period, if you would like to explore the React site, you're more than welcome. In your packs, there are cards which have the URL on. This is a sales pitch. But part of this event is to make it available and make everyone aware of this. We've added in extra cards to give it to someone else that might also find it useful. We are looking for a host, someone that might be able to support the forum and the direct messaging. The version that you've got available is the resource directory and the modules. Okay, so the forum isn't there at the moment. It's built into the back, so as soon as we find the host, we can switch it on. Okay, but if you've got any conversation or questions about that, Ashley Lee up in the, should give you a wave, if you want to give her your details, and we'll